Good evening and welcome to tonight's Monroe City Council meeting. This is a regular study session for Tuesday, April 2nd, 2024. The time right now is 7 p.m. I'm going to ask that Sherry please call the roll. Sherry.
Council members Fulcher, Beaumont, Hanford, Walker, Gamble, Fisher, and Scarborough.
Thank you. And Councilmember Fulcher, please lead us in the pledge. Oh, I'm sorry. Councilmember Beaumont, can you lead us in the pledge, please? I pledge my allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All right, the first item that we have on the agenda this evening is public comments. This is a limited public forum for people to speak to the council during this council meeting. Topics are limited to items on tonight's council meeting agenda and to topics specific to city laws, budget, and operations under the council's authority. Comments that are outside this limited scope will not be allowed. Comments that do not follow the council's rules of procedure will not be allowed. Pursuant to the rules of procedure as amended by council action on December 12th, 2023, spoken comment is limited to in-person comment only for all city meetings, all city public meetings, including city council and all city boards and commissions. Comments will be limited to 3 minutes. Spoken comments that are not within the scope of the time limit of this limited public forum can be sent to the council in writing. Information on where to send written comments is on the agenda this evening and also on the screen. We will begin now with public comment. Is there anybody who would like to speak this evening to the council during public comment? All right, seeing none as listed in the agenda, we'll go ahead and move on to the next item on the agenda, and that item is under announcements and presentations. This is item 5.1. It's Human Services Panel 2023 Annual Report from Rachel Adams. Rachel?
I think I set everybody up here, yep, so you don't have to stand at the front. And then we haven't practiced this tonight, so there may be some awkward handoffs, but I think the message will get across. And I think I'm doing the first introduction and first several slides. Okay, great. Because that's what I wrote out, so I'm glad I'm prepared. All right, so the purpose of the presentation this evening is to share with council the 2023 Human Services Report, which is in your packet. And what we wanted to do tonight was really just highlight some of the city's human service programs, our partners, the data, and then the experiences of Monroe residents who have been really helped by the investments that the council and mayor have been making in our human services programs. So the plan tonight then is to share with you how the city's human service programs support what we're calling the continuum of care. So that's how people enter into the system all the way to how they exit out, hopefully at the point at which they are self-sustaining. We have 5 panels tonight within the human services program, including both internal and external partners. And those panels are covering staff and department support, outreach, treatment, housing, and mental health. And so there'll be an opportunity after the completion of each panel for the council members to ask follow-up questions if you have any. So next slide. Great. So we first want to acknowledge that the city's human services program is still a work in progress. You can see by the human services timeline, although it feels like it has sometimes been much longer than 2017 when the city initially started its program, we've actually only been going as long as 2017. And we started the program with the embedded social worker program. And it has then evolved from there over the years. The council invested and the mayor invested in the city's homeless policy advisory committee. And I think we had a couple of council members, Councilmember Gamble and Councilmember Fisher, who actually served on that committee. I think at the time there were about 20 individuals from all over the community. So it included business owners and residents and service providers, and even some members of our community that were part of that care. And we want to acknowledge that our partners have been doing this work for a lot longer that we have been doing it in the community. But we've come a long ways over the last several years. So the council in 2020 then actually adopted the Homeless Policy Advisory Committee recommendations. And the work that we've been doing ever since then really has been on implementing those recommendations. So next slide, please. I think the council members and many community members will recognize this graphic. We really struggled as a Homeless Policy Advisory Committee to try and consolidate all of the work that we did. And at that time, we identified 5 different service areas: public safety, housing, partners, prevention, and support services, with the understanding that all of that is encapsulated by policy and budget work that we do in the community, both here in the council chambers, but out in the community as well. So it's not just limited to the Monroe City Council or the mayor. Next slide, please. So despite the fact that we've only been doing this for a short period of time, and the work was initially, the recommendations were initially adopted by the City Council in 2020, you can see that even though it's been a relatively short period of time, because of the collaboration that we've been able to do with community partners, and because of the work that Rachel Adams has been doing in helping lead this initiative, we've accomplished a lot over the past several years. But there's still a lot of work that's left to be done. And you can see in the green, that's the work that we feel like we're actually moving on and we've invested in and we've seen a lot of success in. But you can see then in that orange, yellow, or salmon colored squares, those are the places that we're still working to try and invest and close those gaps. And I think part of what has made the Human Services Program successful, in addition to the partnerships that we've been able to create and the collaborations with the members of this community that have been doing this work for a lot longer than we have, is that there are still gaps in that continuum of care. And we need to continue to support that investment if we want to continue to see the outcomes that I think that we've been seeing around the community, and the outcomes that community members have noticed as well. So that is the intent for tonight, is to really highlight the work that some of our partners have been doing and the work that we've been doing together, and to share with you again some of the data and some of the stories about the people in our community that have been helped from entering into the system at a point in crisis to the point at which they're able to exit out again, hopefully in a manner that is self-sustaining for them and their family members as well. So with that, I'm going to turn it over to Rachel. Again, we haven't practiced this, so if the handoffs are a little clunky, we apologize for that.
And thank you, Deborah, that was wonderful. And I am going to, before I hand it over to Caitlin, introduce you all to our new Human Services intern. This is Caitlin, and she has been a fabulous asset to my growing department now, and one of our accomplishments coming into 2024. So Caitlin, would you go ahead and share about this slide?
Yes, hello. Thank you for having me here. I wanted to start off the presentation by kind of talking about some of the contributing factors to poverty and homelessness that are really important when considering what we're talking about today. So firstly, we have rising housing and living expenses, which have outpaced income growth, that leave many individuals and families that are kind of on the brink of homelessness. So in Snohomish County, home prices have increased 136% since 2010, and wages have only increased 52% in the same period. So that kind of gives you a picture of that. Increasingly, more families are spending more than 30 to 50% of their income on housing expenses. And next, for many people, home is not a sanctuary, but as a site of violence and abuse, compelling them to flee from their homes, and often without a safe place to go or the economic resources to secure or maintain safe housing. Many of these are women who many of them report it as the direct cause of homelessness. Struggles with chronic illness, addiction, mental health can all impair one's ability to maintain stable housing, and it can perpetuate a cycle of homelessness. This can be especially true for veterans experiencing PTSD, who may struggle to acclimate to civilian life after returning from areas of conflict. Also, according to the U.S. Interagency Council on Homelessness, more than half of Americans live paycheck to paycheck, which leaves them just one crisis away from homelessness. For instance, losing a job while living paycheck to paycheck can leave individuals without a safety net, and unforeseen health crises can push individuals into homelessness as medical bills can pile up and incomes and savings can dwindle. Additionally, systemic, economic, or racial disparities disproportionately impact marginalized communities, perpetuating cycles of poverty and homelessness. Nationwide, people of color are overrepresented in the unhoused population when compared to the population of the US as a whole. Another at-risk population is those who may have irreconcilable differences within their families, including young people and members of the LGBTQ+ community. Rejection and discrimination from families can sever vital support networks, leaving them vulnerable to homelessness. 28% of LGBTQ+ youth reported experiencing homelessness or housing instability at some point in their lives. So overall, this list does not encompass all factors involved in poverty and homelessness, but many of these factors are compounded and interwoven within each other. However, understanding poverty and homelessness as a dynamic issue highlights the need for a dynamic solution. So this is where the idea or the concept of a continuum of care becomes very important.
So, Rachel, thank you. Next slide, please. All right, so this slide shows a graphic representation of what we're calling our continuum of care. And the idea of the continuum of care is it meets people where they're at and provides an entry point into a system of services that can help people in the areas of advocacy and moving towards greater security and stability. Traditionally, the entry points include outreach, shelter, and treatment, both mental and behavioral health. One of the ways that people are connected to the continuum of care is through our county 211 system. And I know the council has heard me speak about the 211 system before, and you'll hear a little bit more tonight from one of our subject matter experts on the panel. But the 211 system typically has two paths that emerge from a client contacting 211, and those are either through resolution through wait lists and vouchers into housing, or resolution through what's called rapid resolution, which relies heavily on local case management to then help people through treatment as a solution, housing as a solution. My background in emergency management, I look at this as critical infrastructure. In emergency management, the critical infrastructure systems include water, power, communications, and transportation. So when we're looking at a continuum of care like this, you can see how losing any one of these boxes or having gaps and barriers to someone's spectrum of services that are available in any one of these boxes is going to create cascading impacts and is going to weaken the system in its entirety. So in the report that's attached to your agenda materials, you'll see that through the short amount of time that Monroe has been really heavily investing in the work of human services as a city, and through a lot of grant management, we've been able to bolster our continuum of care and create new programs and outcomes through treatment and housing and outreach. Just recently bringing on an outreach, peer support outreach specialist and a case management specialist as new contract services also. So before we go on to our panel, are there any questions from any council members at this point?
Any questions, council? All right, Councilmember Fisher.
Just going through the continuum care thing, so I understand it a little bit more. So do the peer support outreach specialists and the case management specialists, are they the ones that are contacting 211 then or are they part of the 211?
They are going to be separate from the 211,
Okay.
but they'll work with 211. 211 is its own county North
Resource.
Sound
Resource.
system.
Okay.
Yes. So it's important to be entered into 211. That's like the starting place for everyone.
Yep.
Our case management and our outreach people all point people back to 211, but 211 also points people back to case management locally. And so it's kind of that type of a system where it's a yes and.
So if I needed support and I had a peer support outreach specialist contact me, what would I do as the person that needs help? Do I call 211? Can you kind of walk me through that a little bit?
If that was something that that you as an individual were willing to do at that moment.
I am willing to do it.
Okay. I was gonna say, sometimes that takes a little bit of relationship building, as
for
you'll
sure.
hear from our outreach folks. Yeah, that would be your first step, is to call 211 and get entered into coordinated entry, because while that system is doing work towards waiting lists and vouchers, our case managers on the local level can also be working to resolve whatever issues that they can through either providing access to housing or access to other services like
And then,
treatment.
so am I able to answer the questions and do everything needed at 211, or do I need support with somebody to get me through the 211 system? Does that make sense?
Yeah, you as an individual should be able to.
Okay.
People who are in trauma have difficulty and sometimes need some support walking through some of those scenarios that seem like they should be something simple. It can become barriers that are just really hard to overcome. Just sometimes even making a phone call is
For sure, that's kind of what I was getting at. So
Yeah.
is then the peer support outreach specialist, do they help them do that?
They can.
Okay.
They can. I know that, our case management specialist and our peer support outreach specialist will sit on the phone with people and, hold their hand through the process.
All right, that's all I had.
All right.
Thank you.
Councilmember
questions.
Beaumont?
Thanks, Rachel. Really appreciate it. And welcome to our group. Really happy to have you here. Quick question about the 2024 goals. I'm just curious, it's now April 2nd. And do we have a head start on any of these goals? Or any of them in the works? And I had a question about the Recovery Cafe. That sort of piqued my interest and was wondering what that might be.
Yeah, so let's see. Let me pull that part up because I don't have it completely memorized.
They're
One
great
goal that I
goals.
know is on there is referring to a Poverty 101 class.
Yes.
That is something that I have taken on and is in the works now. I just finally am able to get to a point where I have a date from the instructors. So it's looking like it's going to be in September. So we are making really good headway with that, and that is almost completely finalized. We have to sign the papers for the venue, but we are going really well with that. So that's
Wonderful.
definitely one that's going well.
And looking at our 2024 goals, yes, we have a head start on lots of them. The distributing 300,000 in general funds council was a part of in our human services awards. We are starting the budget preparation process for our next biannual budget, which will include proposing funds to conduct the 25-26 Human Services Community Needs Assessment. The council has been a part of already helping to expand through funding to operating 7 days a week, the mental health co-response. We are still working on that Safe Routes to School project and collaborating with Snohomish County and the MAC group. And as far as the Recovery Cafe goes, that is a model that is a national model, and we have one in Everett that I was able to go tour, and that falls into the part of the continuum of care and treatment to support after treatment supports. So it's like you've gone through treatment and now you're trying to live a sober life, and having that support and that accountability around you is really important. So it's providing people with a safe place to go where they can connect to AA, NA, other types of support groups, other types of self-improvement classes, and just have that safe place to continue to grow and deepen
Wow, that sounds great.
their aftercare.
Who's running that in Everett?
They are, each recovery cafe is different. They have a recovery cafe network that oversees all of them. And there are grants funds specifically available for people to begin their own recovery cafe. But right now we in Monroe don't have a lead agency to take that work on. So that's part of, you know, the goals and
Right.
Looking for either a spearheader to take that work on or looking into that model more as a possibility.
Great, thank you so much. I see a lot of great partnerships on this list of goals, and it's a great list. So thanks so much. Really support the work that you're doing.
Thank you. Any other questions at this time? All right, go ahead.
All right, next slide, please. All right, so some of our connections and outreach come from our internal partners. And so we have up here listed several ways that people connect to our service providers and to the continuum of care through the city of Monroe. Things like the community court, our police department, finance and utilities. Any of you who get a Monroe utility bill may have seen some of our material coming through utility billing, community development department, and parks department. So I'm going to go ahead and invite Mike Farrell, Judge Ness, and Brian Irving forward to share a little bit about their work and how their work connects to human services. Oh, yep, and we're going to go ahead and give you the table.
So
It's
good.
like a state legislature moment, doesn't
Yeah.
it? Mike,
I don't know how close I need to get to this. Okay.
You each
So-
have 30 seconds. Thanks for driving all the way down to Olympia.
Yeah. So good evening, Mayor, Council. So for parks, I just want to tell you that and our team, we're pretty excited that we actually have an additional complex resource. I'm still learning the terminology as far as the continuum of care, alternative response team, but I will tell you this is that in the past, our only alternative when we encounter in our parks, and we have over 250 acres of parks that we have to maintain, our only option had been to, when we encounter somebody that's experiencing homelessness, is to call 911. And then the staff, we don't want to leave the situation. So, take some time, folks may be busy on other calls, that sort of thing. And so a lot of time goes by and our staff aren't trained to assess people or even, as far as hopefully we're doing the right thing, that sort of thing. So, so anyways, with the added resources that the city has now with, we met a few weeks back, Donnell and Roger, who I think you'll meet a little bit later here. We're really excited that the folks that we encounter in the parks, they can get some professionals to help out with their crisis of whatever they're experiencing, and then our staff can kind of continue on with their primary tasks in which they've been trained for, which is to maintain the parks and facilities. So anyways, we just see this as a good thing, and I want to tell you a little side story as an example of just the benefits of expanding in our human services here. Is that this was probably about, I don't know, maybe 4 months ago, something like that. It was last fall. Our folks encountered a few people that in Alborland Park, and there was all of these, looked like their possessions, belongings, that sort of stuff, just in the park. And the story was that they were evicted from the nearby apartments, and they didn't really have a place to go, didn't know what to do. And so our staff, again, we're maintaining parks, and so what do we do? But Rachel was able to assist. I believe police might have been involved as well, just to help these folks. But Rachel gave assistance so these people could find some other place to, well, first to protect their belongings, so then they didn't get lost or stolen or whatever. But more importantly, to find some shelter, some housing for these folks temporarily.
Just want to tell you a little story. Here you go, Judge.
All right, good evening, Council, Mr. Mayor, Ms. Knight. The therapeutic court, I would add to Ms. Adams' slide, is also an entry point into the continuum of care. So I'm going to start with an example. It was our last community court graduate that we had. He was unhoused, drug addicted, living in a tent on the DOT property up here. And he, through the help of the Monroe Police Department social worker Delgado, got into inpatient treatment and then was released into a clean and sober living facility. And he was a part of our community court. He was also involved in the recovery court and participated, Councilmember Beaumont, in the Recovery Cafe and had wonderful things to say about it as well. So that's an entry point through the therapeutic court for individuals in our community that are charged with those low-level quality of life type crimes to get access to some of those services, to make a connection, a link to the service providers. Another community court graduate that we had, she's a grandmother caring for her 4-year-old granddaughter. Unfortunately, the mother is addicted to drugs, so she has custody of her 4-year-old granddaughter. And so she was receiving some services through the Department of Child Welfare, but she was in need of additional services. So as part of the continuum of care, the resource providers that we have were able to supplement some of the needs that she had existing that she wasn't able to receive through that other department. So it's really about connecting people with resources in our community and through our community court. And I see a lot of familiar faces here in the background. I see some of our service providers here. It's, substance use disorder evaluation and treatment, mental health evaluation and treatment, bus passes, food vouchers, clothing, assisting with someone receiving a telephone, a phone that they can use, signing people up for healthcare. And so, having these, what I am going to say, life-changing connections makes a really big difference. And I shared this story with you last month when I saw you about Ashley, the community court graduate that we had, that it wasn't just a change for that individual, but for her family, for our entire community that we have. So we see some real advantage to being an entry point into the continuum of care and then assisting individuals with accessing those services in the continuum of care. So I won't take too much time. I could always talk forever about the therapeutic court.
We only got 30 seconds, so we're good. Good evening, Mayor, Council. So I couldn't do all the service providers here justice by giving all the examples that we've had relationships and worked collaboratively over the years. So I'll just talk about a couple things that are important to us. First of all, I'll start off with the community outreach team that I was part of starting 7 years ago. And so I am biased in that I had a hand in starting it, but it was really based out of necessity. We as police officers were given training on a variety of topics, but we're not trained in all topics and how to de-escalate every situation or make connections or provide resources. So based out of frustration and the need to provide resources to people in the community, that's how that program began. And I'm proud to say it's gone on for 7 years. We've had multiple success stories of providing people with housing, treatment options, getting families into apartments, and things like that. One of my favorite stories is that there's 2 brothers that were drug addicted on the street. I can proudly say they now have a business, they have a house, and they've been successful for several years and clean and sober through the programs. And they also were involved in the court process as well. So that's just one aspect, but I look at it as really a great asset and a great insurance policy to make sure that we have a continuum of care, if you will, that we're not just a law enforcement branch, because not every problem is a law enforcement issue, but we're still called there to deal with it. I can transition that into earlier this year, we had a situation where we were helping a client, a family with an infant child. There was a lapse in housing between the time that they had their temporary housing to their permanent housing. We did not find a solution. We ended up reaching out to Donnell, who was able to house the family and fill that gap in housing until they could get into their permanent housing. We didn't want that family with an infant on the street in a car during cold weather. So that's a success story that we had utilizing Donnell with that program. And she's actually facilitated a relationship with Best Western so we can bring people into that location if we need emergency housing after hours. The last provider that I'll touch on is Jessie Byer, who's with DOA. She's our co-responder. She's been amazing for us. There's been countless situations. As I said, we have limited training on how to deal with people in crisis, and she has expansive training. One situation involved a very young child who had threatened violence with a weapon against themselves and family. We responded to the scene. As you can imagine, in law enforcement, we don't want to take police action with a young child. That's not our role necessarily. She was able to come to the scene after we weren't able to establish rapport. She established a rapport, as I call her, with her superhero cape on, was able to actually ran around with the child to establish this rapport, got the child to the necessary medical treatment that they needed. This was a valuable asset for us that led to a successful resolution. So those are just a couple examples of how we've used these service providers and been successful with it. So I appreciate them and what they do. Thank you.
Any questions before we bring up the next couple people? Thank you.
All right, thank you. Our next slide, please, is going to take a deeper look at that outreach branch of our continuum of care. So for this, I'd like to invite up to the table Roger Evans, Tina Pamanian, and Mike Lorio. And I've asked Mike to share a little bit about what he does and some stories, if he has some prepared. And then, of course, the council is welcome to ask questions of any of our panelists. We do have a lot to cover, but Mike is going to do a great representation of what outreach is and why it's important to our continuum.
I made sure to prepare a statement. Go off on tangent.
Good job.
Thank you, everyone, for having us. Can you hear me okay? Okay. So, like I said, I can go off on tangents very easily, so I prepared a statement. Please forgive me if it's a little rote, but it also is important to kind of establish what the parameters are and what the purpose and philosophy is behind our outreach program. So, Take the Next Step exists to build a better community by strengthening families, excuse me, and individuals, helping them find their path to wellness and personal fulfillment. The way to build up a community is by affirming the unique personhood of the individuals who are a part of it. By coming together and exercising our individual gifts, talents, and experiences, we can express our unique communal identity as a town of Monroe. We can be determined to be a strong community where people feel safe, recognized, and supported, regardless of who they are or the problems they may be trying to overcome. However, if we struggle to help those who are visibly hurting the most in our society, we will continue to struggle in knowing how to help those whose hurts are less obvious. It is similar to a hospital emergency room. We learn through practicing emergency responsive medicine in acute cases how to better practice preventative medicine in the future. Mental and emotional health, addiction issues, financial stability, these are all topics we recognize as being critical to family health and therefore social welfare. When we learn to care for those trying to deal with the most while having the least, we learn how to care and share with everyone around us. The framework for our outreach program is extremely simple in principle, but fairly dynamic in practice. The essential difference between households that can weather crises is, in most cases, having a strong support network. Our aim is to develop relationships with our unhoused neighbors to bridge the gap and build a new support network as much as we possibly can. Unhoused folks live in a type of perpetual survival mode, which makes it difficult to assess their situation in a balanced way and to make long-term decisions for their well-being. Add to that substance use disorder and mental health symptoms or diagnoses, taking steps forward can seem next to impossible. Our goal is to offer help in 3 key facets to overcome these hurdles: basic essential needs, long-term relational support, and bridging the gap between them and the continuum of care of essential providers. The level of basic needs that we are able to fill obviously is not enough to make a lasting difference to their circumstances, but it does help by taking the emotional edge off of that sense of survival. That can mean the difference between choosing getting high or having a conversation with that service provider. Long-term relational support comes through our teams being comprised of a mix of local community members, faith leaders, and essential providers. Everyone does better caring for themselves when they know there are others who care for them too. We hope to have that spiritual transaction that builds up an account of trust. If or when the right time comes, we have a level of trust and respect where they reach out for assistance. We also provide a mobile contact point for that continuum of care by either having providers accompany us, such as the peer outreach for Ideal Option, Conquer Addiction, as well as I said, faith providers, where they're meeting people face to face. We're able to make contact, we're able to do work on the internet, apply for phones, apply for benefits, apply for health insurance right there in that moment for them, and make those different transitions and help them move forward. A great example of that is just very recently, there was a 62-year-old gentleman who, because he was 62, was just below the age of really getting a lot of assistance that opens up when you're a senior. And through the assistance of multiple providers, Donnell, even, my mind is really Carmen Prada from the Seventh-day Adventist Church. The gentleman lived in a van, and he was going to transition from an old van to a new van, but he couldn't because he had to figure out what to do with all the stuff he had stored in his old van. So a representative of the Seventh-day Adventist Church offered her dumpster so that we could clean out his van and allow him to transition into a new van. And then with him working with the housing navigator, Marta Jimenez from VOA, we were able to get him moving forward into housing. Another great example, I think, and this will be the last one I use, is a community member who is 43, was born and raised in Monroe, dealt with an opiate addiction that she accrued through an actual car accident, managed that, went through treatment, was living relatively successfully, had relational issues come up, the household split up, has been homeless for many years now, had dozens and dozens of conversations, connected her to many different providers, just continued relatively stagnant. But then Aaron Lopez was with us one day on outreach, and there was just something about the way that she could connect with her and talk with her, and there was a different kind of conversation, and you could see things move forward in her mind and in the way that she was looking at things, which motivated her to apply for treatment again. I don't know where she is in that yet, but still a very successful story.
Are there any questions from council members for any of our panelists? Again, this is Roger Evans, our peer support outreach specialist. This is Tina Pamanian. She is our McKinney-Vento district, McKinney-Vento school district liaison.
Any questions from the council? Go ahead, Councilmember Fulcher. We have the microphones this evening.
Well, I feel like since Roger is new and that we have just approved his funding, I know that you've got a success story. Is there I know you also like to talk. Is there a quick one that you can give us?
Yeah, so for many of you don't know, I was addicted for drugs for 35 years. I got 7 years and a few weeks clean and sober. For the last 6 years, I've been in Monroe doing this kind of work, working alongside Michael and many of the people here today. Yeah, one success is, filling in the gaps, looking at the gaps. Rachel Adams does a wonderful job of trying to work together to figure out what those gaps are. I had a call one morning about 8:45. I was on my way to the community breakfast, leaving the coffee shop. Hey, my son just got out of jail. He wants to go to treatment. Can you help? Oh my gosh, it's 8:45 in the morning. What am I gonna do? Yeah, I'll be right there. So I was able to, within 1 hour, reach out to Eric at Every Recovery, and we came up with a plan, and we took the gentleman to the hospital. The plan went sideways, which many times does happen, but by the next day, the hospital was great. By the next day, we were able to get him into a co-occurring program down in Lacey, and I just heard from his mom 2 days ago. He's in Spokane in a long-term program. The mental health was overshadowing the substance abuse, which sometimes does happen, but trying to get him stable enough to work with the substance abuse, it worked. Now we cross our fingers and hope he continues through the program, but we did our part. We got him into the system, and we just wait and hope that it all works out. There's many stories, and like Heather said, I could go all day, but that is one sample of being able to guide them, hold their hand, and walk them through the system. I spent about 14 hours that weekend at the hospital, off and on, so it was a great turnout.
Council members, any other questions? All right, thank you.
Thanks, guys. All right, our next panel, next slide please, is going to dive a little deeper into our treatments section of the continuum of care, and I'd like to invite up Eric Britt from Evergreen Health Recovery Center, Jacob from Concord, and Aaron from Ideal Options. And April, if you'd like to join, you're more than welcome. We have 4 chairs, so. April is also with Ideal Options. So for this panel, I've asked Eric to prepare some remarks and a story. And then again, council is welcome to ask questions of any of our panelists.
Good evening, council members, mayor, this night. Nice to see everyone. Thanks for having us. I was just struck, I'm going to talk about treatment, but how complicated this is. It takes an army like this, so many of the people in this room, and coordinated by folks like Rachel. What an amazing job Monroe does. I'm really honored to be a part of it. And it wasn't always like this. I'm the director over at the Recovery Center, directly across the street, department of the hospital here in Monroe. We focus primarily on substance use disorder, and as we're hearing tonight, and as most of the folks in this room know, the lines are real blurry. Mental health issues, unresolved trauma, substance use disorder, and all the other poverty-related issues. So it's complicated and it's hard for folks to navigate. It's hard for me to get my mind around, and I've been in it for almost 20 years. So the treatment piece at the hospital, the Recovery Center, we're primarily focused on substance use disorder. Of course, we have to do a bit of mental health. We have a whole continuum of care of our own related to substance use disorder. So from the highest level, medical detoxification, being managed by the docs and nurses, all the way down to weekly outpatient treatment and everything in between. I'll focus just for a minute on the higher levels. So when folks are experiencing all the issues that we've heard about tonight, but the substance use disorder, their substance use they can't interrupt it for long enough to deal with the other issues. That's primarily where we come in. So they'll come into the hospital, into the Recovery Center. We'll safely detox them, get that physical component, off their back, and then and then through residential treatment. And so not everybody needs that intense level of treatment. Many folks are able to find success at the outpatient level. So we've got Jacob from Conquer Addiction, we've got the Ideal Option folks, we also have CMAR here in Monroe that can provide outpatient treatment, both substance use disorder and mental health, and medication management, which has become so important, particularly with opiate use disorder and fentanyl. So we're really fortunate to have that whole continuum here in Monroe. Of course, there's some gaps, and I'm glad that's what we're beginning to focus on. But we really have everything. And what I've particularly enjoyed over the last couple of years is this group of separate service providers coming together, working together. Roger's story, and we're all texting and calling each other at all hours and weekends just to try and take care of these folks. And also, as Roger said, the plans and the stories go sideways often. That's sort of the nature of it. I've grown relatively numb to it and just roll with it. And I think most of the folks on this side are similar. But it's repeated touches with these folks. It's developing rapport, and it's them learning, even if they're not successful on the first time, like, oh, I've been through that once. I know what to expect. It was comfortable. They treated me with respect and dignity, and I'm going to try again. And lots of our success stories come that way, fortunately or unfortunately, however you look at it. At the Recovery Center, we've had folks referred from all different folks in this room, from the court, from the embedded social worker, from the police, from the outpatient clinics. We all refer back and forth to try and take care of the folks and get it done. I'm kind of rambling, but when I think of stories and success stories, I mean, hundreds and hundreds of them that I have just off the top of my head. I'll just think of a couple that were more poignant or compelling. So a few years back, a young woman, 26, had been unhoused in the bouncing between Monroe, Everett, Sultan, addicted to opioids and methamphetamine, had been in and out of some outpatient treatments, could not find success, and was most of the time homeless. Anyway, found out she was pregnant. At the Recovery Center, we do have a pregnant women program. And so she came in through that, went through detox, was stabilized on medications, completed residential treatment, went on to our outpatient levels. Several months later, about 5.5 months later, while she was in our weekly outpatient, she delivered a healthy baby boy, and got into clean and sober housing, got a job, went back to school, found childcare. Just exactly, picture perfect success story. I just got a call today from a young man who was also unhoused in the winter in this area on the Highway 2 corridor here. He came to us a couple years ago so bad off. He'd been outside in the winter, and both of his hands were so severely they were black with frostbite. And so a lot of medical care that was cumbersome, but got through the program, got through residential treatment. He was fighting to get back in the lives of his 2 young children. And so it took a while, but he stuck with it. Clean and sober housing, outpatient treatment, medication management, the whole nine. Anyway, he called who was his counselor there today, who reported this to me. And so he's back in the children's lives now, and he just got his pilot's license, which was just amazing. Yeah. As you can tell, again, hundreds and hundreds of these stories. And I want to give the other folks an opportunity to talk for a minute. Is that? Yeah. Okay.
Does anybody else have anything that they want to add?
I'll take questions.
Councilman?
Thank you, Council. Thank you, Mayor. Thank you, Ms. Knight. So I'm one of your success stories, to be perfectly honest. I come from the Gold Bar, Sultan, Monroe area. I was homeless and addicted, probably in a tent down by the river, right down here. Getting clean was not an easy choice for me because I didn't know where to begin. It's not that I lacked the mental acuity to do it. I just lacked the self-confidence. I was suicidal at times, many a times. I felt very cut off from all of my family supports, any friends that I had. I didn't know where to go. And I utilized the embedded social worker Delegado to get myself clean. Worked very hard for the last little over 5 years to then be able to bring a clinic back into this community where I saw a need. And it was one of the highlights of my life. Being able to serve this community and give back a little bit from what I took has just been an absolute blessing. But we still have work to do. Unfortunately, I had to leave this community to get clean and sober housing. So having an initiative around clean and sober housing, having an initiative around the Recovery Cafe and offering that after the treatment supports. I think we are so focused on the treatment portion, which it sounds like we have a fantastic set and team of. Now we needed that continuum of care, continuing the continuum of care and offering those wraparound services, those supports for after treatment. When I got done with treatment, I still didn't have my family back, didn't have a job, wasn't able to work for a little while. The clothes on my back, which no longer fit because I was eating again. So I had nowhere to go. And without the help and support with the social workers, voucher programs, and some clean and sober housing, I would have been right back into that cycle. So I implore you to please continue to support the efforts of this Human Services Department and the efforts that all of our service providers here have strived so hard to fill those gaps for. Thank you.
Thank you. Any questions from the council? Councilmember Beaumont?
I just want to thank you all. I'm sitting here listening to these stories and I'm just overwhelmed. I have no words. And, you say you're texting each other at night and you take every single person. It's not just a person that needs treatment. I can tell you all get very much personally involved with the outcome and you care about these people. And that's why you're texting each other at night. And I'm sure you need support yourselves doing this work. I'm so proud that we have these services and people like you working to help those in need here in the community. And you said sometimes you get numb to it, and I'm sure you have to get through it. I just want you to know that I am not numb. I am feeling everything that you're talking about tonight. And this is a great presentation, and I'm so grateful to all of you. Thank you.
Any other questions or comments from the council? All right, thank you very much.
Thank you. All right, so that was a really good transition into our next slide, which is housing. So for this slide, I'm going to go ahead and invite up Lindsay Gagnon, who I've asked to prepare and speak about a little bit about 211 and housing offered through the new Emergency Housing Funds contract. And Kieko? Okay, come on up. From Cocoon House to go ahead and share a little bit. And Donnell, are you able to share anything on the St. Vincent de Paul housing program? I know I'm putting you on the spot. We're going to be up and running. If you'd like to come up to the panel, if council has any questions for you, we can answer. But I have specifically asked Lindsay, who is a subject matter expert for VOA and one of my dear friends, to share about this slide for us.
Thank you, Rachel. Thank you, Mayor, and thank you, council members, for even having us and considering this panel tonight. So I'm Lindsay Gagnon. I'm the Executive Director for Volunteers of America's Community Resource Centers in Arlington, Lake Stevens, and out in Sultan, our Sky Valley campus. We also hold the contract for East County Navigation Services, which I'll talk about a little bit more. So to start, I want to just backtrack to talking about 211. To say 211 is primarily the county's main information and referral line and resource line. So they also hold the contract for a coordinated entry system. So Those two are different. And so if you can leave with something tonight, you can leave with that distinction. When you talk about 2-in-1, it's the main centralized hub for taking in folks that are in need of getting into the coordinated entry system, right? So what the coordinated entry system does is incorporate a uniform screening and assessment process to prioritize and match vulnerable families and individuals to available housing and services. It follows the federal HUD definitions for homelessness, so meaning an individual or family currently living in places not meant for human habitation, like on the street or in cars, even emergency shelter is considered one of those. Situations like couch surfing is unfortunately not counted as one of those. 2-in-1 is again the centralized hub that does enrollments for Snohomish and recently Skagit counties. There are also other agencies able to do that throughout Snohomish County, as well as few housing navigators that are able to do on-site assessments. So 2-in-1 is again one of a few different ways folks can connect to the coordinated entry system. It's important to know too that 2-in-1 are call takers and not case managers. They are assigned to take calls. They're a huge call center, and they refer to resources and conduct these intake assessments. So when someone calls into 2-in-1, for instance, an assessment will be given by the call taker to assess their current housing situation. If they qualify for a homeless navigator or a prevention navigator, which means that they are at imminent risk of losing their housing. So within 14 days, if they have an eviction notice. Once that eligibility is confirmed, the call taker will then assign it to an agency in the area that the individual or the family is residing in. So for East County, the service area is from Snohomish, the city of Snohomish, to Index, and everywhere in between. So when someone calls from Monroe, they will be assigned to the East County navigator, Martha Jimenez, right now, that works for us out of the Sky Valley Community Resource Center. Once assigned, the navigator will have roughly 7 days to reach out and set up an appointment with the client. So that first meeting is very important. That's when it takes about 1.5 hours to 2 hours to do a deep dive assessment into their entire situation. So they're primarily assessing vulnerability. To continue services, a client must maintain contact every 30 days with their navigator to stay in the system, or they will be exited for no contact. This brings me to a point of clarification that you might not have heard otherwise. Coordinated entry is not a list. Think of a pool where the most vulnerable rise to the top. And per the county, vulnerability considers those with children, those living with disabilities, and those with very chronic homelessness. Less than 10% of those in coordinated entry will actually receive housing through the available subsidized and unsubsidized housing programs that are available. There is simply not enough housing units in this county, in this area, everywhere right now. Now, what else does a navigator do in this case, right? Well, they actively search for other available options and creative options at that. So what we do for East County Navigation is we work in tandem with local resource centers like the Sky Valley Community Resource Center and my support specialists, my case managers there. And also our huge partners Take the Next Step in Monroe, who have qualified and experienced case managers for years, to really provide that consistent wraparound services for clients in homelessness while they connected to the navigator. So navigator, right now, she has over 90 people on her caseload, or 90 families and individuals. That is a lot for someone that is trying to move someone into stability, trying to get them housed. So what we do is provide a wraparound approach. And so by connecting and having that tandem work with a local case manager or a local support specialist, that individual or family is able to get their basic needs met on more of a daily basis than having to constantly connect with their navigator that has the same number of hours in a day as you do to try to get everything done, and is actively working on creative solutions to find housing, which takes a lot of time. And so really we've seen a lot of success with this model, more so than in any other part of the county. Last year, a navigator housed over 30 families and individuals, which might seem small, but is actually pretty large compared to the number of available units and just availability all Nearly every case took that coordinated effort, that collaborative approach with agencies like Take the Next Step to get them housed. It's also important to know that once an individual or family is housed, they effectively exit the navigator's caseload, which is another reason why these wraparound services are so important, is because should that family or individual come into need down the line and may be at risk of losing their housing again, they're now connected to local resources and local agencies that are able to assist them and able to help them as much as they can to stay housed, which is huge. So I know you mentioned the East County Motel Program, which I can speak to a little bit off the cuff. I wasn't totally prepared, so forgive me. I'm here to answer questions, but we recently entered into a contract with the city of Monroe to provide East County motel to those that are in transitional shelter that really are on an action plan, and that within 30 to 90 days we can get them into stable housing. And so we're working with local motels to provide that, because even if someone has a voucher or has a plan to get into housing, they're still living in the car. And so we're helping those families, a lot of them with children, a lot of them with babies that are 2 years old or younger, get into motels while they're anxiously waiting for that housing. And so that's going to be a life-saving program for so many families here, to offer that transitional shelter. It just simply doesn't exist. So thank you for your time. I hope I can answer any questions that you may have.
If any of our other panelists have anything to share, yeah, go for it.
Hello, everyone. I'm Keiko Duncan with Cocoon House. I'm so excited to be here. We've been in the Monroe area, actually serving emergency shelters since 2011, and so it's a great honor to be part of this continuum of care and speak to that. If you don't know about Cocoon House or vaguely familiar, we really serve the population between that 12 and 17-year-olds through our emergency shelter, and really focusing on getting that first step, getting them safety as far as emergency shelter goes. Actually, right down the street is where our emergency shelter is located. We have an 8-bed facility where they can stay up to 21 days, and our case manager there, she is incredible. She works tirelessly in those 21 days to find the next safe and stable place for our young people to be. And sometimes that's working with our partners. I see them up there on the list with Housing Hope. Sometimes that's within our own programs for more long-term transitional living. And of course, always striving for reunification with families, and then coming in with that family support with our family engagement and prevention services to hopefully be able to work through any kind of conflict that maybe led to this situation of separation, or get them connected to other resources as far as mental health support. We partner a lot with CMAR for their behavioral health walk-in, and always looking for more partners as far as substance use goes, and how it's affecting minors. But yeah, we're really excited to be part of this, and that entire continuum of care. Navigation is a huge piece for our young adults in East County. That's a big one. It's huge. Thank you.
Okay, that is totally fine. I had hoped to see Inga here, but that is totally fine. So,
Actually, I'm going to ask if you could just tell us a little bit about St. Vincent de Paul. That's who you're with, correct?
Correct.
If you just talk just very briefly about, to the best of your ability, I know this is getting you sort of unprepared on this one, but you just talk just a little bit about what you do. I see that you're on the continuum of housing up here, so maybe just providing a little context there for people who haven't heard of St. Vincent de Paul.
Absolutely. St. Vincent de Paul actually has 14 conferences in Snohomish County, the local churches. St. Mary of the Valley is here in Monroe. We offer assistance, financial assistance through the churches, through the Resource Center is mainly emergency services that we provide. We do grocery vouchers, laundry vouchers, clothing vouchers, phones, pretty much whatever the need is, we will try and fill it to the best of our ability. We have an assistance line that can be called during the weekend. It's all run by volunteers. Our churches is run by volunteers. They do outreach to where they go to the homes, they visit with the individuals and try to establish what their barriers are that's keeping them to keep calling and asking for help, trying to get them to be able to move past that point and be self-supportive in their own. And the Resource Center was opened up to be able to offer space for other organizations, other businesses to be able to come in and offer their services in the Monroe area, in the East County for the individuals who are in need, finding those gaps, as they say, that are needed, trying to figure out where we can come in to help and assist the best that we can. We offer our space at no charge for anyone to use. We have several different organizations. 211, as a matter of fact, is up 2 days out of the week. We have the LEAD program. We have Conquer Clinic has been in. We have a counselor that comes in on Wednesdays to work with individuals and has a free 15-minute session with them to see if she can help in any sort of way. We have Snowco Connect, Cocoon House that she's with also, Sunrise Services. Who am I forgetting? I think we've done a lot. We've got more space to be able to fill on different days too. So we're just always looking for that need, trying to fulfill that.
Thank you. Rachel, anything further from this group? And I'll see if there are questions.
Yeah, no, I just wanted to highlight, because I didn't mention before, that up on the screen, what you're seeing is the housing continuum. So that shows on the screen the spectrum of housing from homelessness to emergency shelters, supportive transitional housing, and all the way through the housing market. And above those spots in the housing continuum, you'll see the organizations listed that are really specializing in those places on the continuum. So 211, Volunteers of America, St. Vincent de Paul with the new Human Services Award for their housing with wraparound services, as you heard spoken about, is going to fall in that beginning of the continuum of care. And so two of those major players, and Lindsay with the emergency housing voucher, those are large grants that support those programs that are able to help in that entry point in the beginning of the continuum for housing. Cocoon House, Monroe Women's Gospel Mission have done wonderful work in the area and for a long time. And they're a great example of our supportive transitional housing and social housing that is program-based and able to support very specific niche groups. And then, of course, housing help. So yeah, I just wanted to highlight what you're seeing on the screen there.
I'd like to take a moment. I think we introduced a term this evening that maybe not everybody understands. In fact, two terms. One is the term continuum. The other thing is entry point. And so to me, the definition of continuum is kind of what you're seeing displayed on that screen right now. It's the concept that you can start at a point, and through the process, you reach a point, in this case, of self-sufficiency. In this case, moving from the left of the screen where you're unhoused all the way to the point of potentially being able to buy a home, which is the market home ownership. So that's what the continuum is it's not hopefully not a circle, but it's something where, you enter at some point during this and you receive the support and assistance that you need to the point where you become more and more self-sufficient, to the point of self-sufficiency. And you've already heard, at least from a couple people, one person has shared their story with you in one of the previous panels here. And so again, this right here, I would call this a continuum of housing. The other thing is continuum of care, which are the wraparound services for chemical dependency, mental behavioral health, poverty, getting access to health care, and so on and so forth. All of those things that we've been talking about. Those of us that have jobs probably have health insurance. So if you had a problem with frostbite or chemical dependency, mental behavioral health in your family, you're able to get the help that you need through your health insurance. But people who don't have a job, who lack the resources, don't necessarily have that option. And so that's part of the gap that we're talking about here. The other concept was entry point. So not everybody is starting off in their interaction with local government or with our community at a point of, on the left side of the chart, of being unhoused. You have people that, and we talked about this as part of HPAC, where the idea is that you want to stop people from reaching that point where, wherever that pivotal point is, where all of a sudden they're losing more and more of their ability to be self-sufficient, and the resources to help somebody climbs, and the number of interactions with law enforcement and negative interactions with community could potentially climb as well. So we talked about trying to stop that cycle of people entering, lower and lower parts of the continuum where the entry point is closer and closer to law enforcement. And so that's one of the things that we're talking about here is an entry point is going to be case specific. Every person is going to have a different life experience, a different place in where they are in their lives, and therefore you have a lot of different providers that sort of are involved in different entry points in the continuum of care or the continuum of housing. So I just wanted to explain those two terms. I'm hoping that that helps if you didn't already understand what we are referring to with continuum of care or housing, and then also entry points. Okay. Any questions on that? Okay. Anything further from this group, Rachel? Thank you.
Whoa, whoa, whoa.
Oh, I'm sorry. I looked this way. Yeah, okay. Okay,
Go ahead.
so, yeah, go ahead, Councilmember Walker.
Go ahead.
Just before anyone else takes off, I wanted to also just express my profound gratitude, all of our profound gratitude. And Mr. Britt actually took the words out of my mouth when I looked around the room at the beginning. I'm like, this looks like an army, like a benevolent army that Monroe is so blessed to have. It's amazing that in a city our size, we are able to have this many incredible people. It's clearly more than a career, and you can see it in all of your guys' eyes and hear it in your stories. And we are just so blessed. So thank you very much for all the work that you do. And I'm sorry that we don't have more questions. I think, as Councilmember Beaumont said so well, the stories are just incredible, and I think they're shocking for the folks that don't deal with it every day like you guys do. So it's a testament to just how incredible you guys are. So thank you very much for everything you do for our community.
Thank you. Councilmember Gamble.
Awesome. Great. A lot of the same thing. I do have questions. I'm a data guy, so. But that's, it's really cool to see in the room. I was a part of the original Homeless Policy Advisory Committee, and, some of those brainstorming sessions. I know Councilmember Fisher was too, back before he was a council member. That's how he was integrated in. So it's just really neat to see some of this stuff come into fruition, and then people as advocates, part of it, and leadership positions that have benefited. It's outstanding. There was questions in regards, so I'm glad you brought it up, and it was more around the coordinated entry, because none of us really, there was no definition of like, okay, what exactly is that? How do we, because questions do come up that came up during that grant process when we reviewed was areas of concern from folks that brought us up, well, wait a second, there's no, if someone has a felony, if there were a lot of that you can't check for that. And so that's when the questions came on coordinated entry. And I just want to make sure I got it right. So I'm a data has no feelings guy. I just like to know, the data so that it could be, considered in, and so we can answer those questions from what I'm taking. So the grant that was provided, really it's helping those that are in the holding pattern. They're already working with an advocate, right?
The East County Motel Program you're talking about?
Yes, that's correct. Yes. So they're working with a navigator, or
Yes,
and,
that's one of the qualifications.
Correct. So they have to be working with a navigator. So because the way that it was presented, so this helps me a little bit too, is that we would be able to help a lot more people. But it's not more people into the program. It's really helping the ones that are already in get temporary housing that don't get it today.
Yes.
So it's not like just to answer those, it's not a huge influx of folks that are It's just helping those that are already there, we need more, so that they have a place to stay while we're waiting to getting them into the program.
Yes.
Or into permanent housing.
Yes.
Okay, great. So that was one of the questions on that. And then I saw, so the prioritization, if I heard you right, was children, disabilities, and then chronically homeless.
Yes.
So, but it is the chronic, or of that subset or that group, that's the piece where I say, look, we can't look, if they have a warrant out currently or something, is that a part, that's not a part of the process at all?
No.
So that, okay.
No.
And then the other question that came up from others that I was getting was citizenship, and that's obviously not part of that either.
No,
Okay,
no.
Great.
That's not.
okay,
Thank you.
great.
And I can follow up specifically with more specifics to all of you tomorrow. And connect you with that specific program manager to answer any other specifics.
No, I appreciate it. It's just, it's important to get those data facts out there. Obviously, when you're dealing with taxpayers' money, you know, that comes up. So we need to be able to speak to that, not be afraid of it, and just, you know, and explain the why. So I appreciate it. Thank you.
And if I can, Councilmember Gamble,
Yeah.
also just put into a great kind of saving grace to the East County Motel program is it will really affect families with kids. There are hundreds, and I wish Tina was able to speak to the number that are on her McKinney-Vento list right now. There are hundreds of families that are unfortunately sleeping in their cars or in a place not meant for habitation. And so this will help those most vulnerable families get off the street and get into something meant for habitation. So to really reduce that trauma that the family's experiencing, especially for those kids. So I want to put that out there of how important this program especially is for me, because you know, protecting our families with kids should be among the top priorities.
Oh, absolutely. I mean, I was shocked. I also serve on the Monroe Public School Foundation Board, and was very much surprised of the large number of McKinney-Vento that we have. So there you go.
So
Yeah.
can you repeat that number? Okay, so I just wanted to make certain it was caught on the microphone. It was 285?
285.
285.
That's actually down, if I'm not mistaken. Yes, because I'm remembering numbers. I would. Okay, yeah. All right.
So 310 at the end of the year, and
Well, I remember the 300 number. It wasn't 3, it was like 385. So I don't know if
385.
it was from years gone by, but okay, great. Thank you. That's exactly what I was looking for. And thank you for, appreciate it.
other questions for this group? All right, thank you very much.
Thank you. All right, the next group that's going to come to our panel table is going to be our mobile mental health co-responder, Jessie Beyer. Take the next step, has their whole team over here, but I'm going to ask Sarah and Sarah to come on up. And Concord Clinics, Jacob. And I've asked Jessie to prepare some remarks for the council this evening and share some stories. And then, of course, again, the council is welcome to ask questions of any of our panelists.
Well, good evening, everyone. Thank you for having us and for your attention and your interest in the work that we're doing in the community. As Rachel said, my name is Jessie Beyer. I am the East County co-responder for Volunteers of America. I work with both the Monroe Police Department and the Snohomish County Sheriff's Office, as well as the 2 fire districts out here to respond to individuals in the field who are experiencing some type of behavioral health crisis. This could be anyone who calls 911 because they're considering suicide, to someone who is in an active psychosis and someone calls on their behalf, to someone who is in an acute substance use crisis and is looking for some level of support and healing from that. Our program, specifically the co-response program, started just in June of last year, so we haven't even hit our 1-year mark yet, but already we've had a number of incredible success stories in collaboration with a lot of different community partners. DC Irving spoke to some of them from our program specifically, but a few others that I'd like to highlight. One was I received a call from the Monroe Police Department for a woman who was at the Fairgrounds Inn. She was experiencing an acute alcohol crisis and wanted support getting into detox for that. She shared that she had been kicked out of her home. She wasn't able to see her kids. She was losing her relationship with her partner, was very, very distraught about that. And the most complicated piece of this was that it was about 10:30 at night on a Saturday. Most of you guys know that many of the community resources that we have are available 9 to 5 or 8 to 8 if we're lucky. So a lot of those after hours on the weekends calls that fall on my plate, it gets a little creative as to where we can place this person, how we can connect them with a resource that's going to be supportive of them to de-escalate that immediate crisis. So as Eric was saying, I am one of the many people who call him at 10:30 on a Saturday night. And so I was able to get in touch with him and secure that woman an immediate placement at the detox center that evening. Another slightly unique element of that story was that she had already been verbally trespassed from the hospital earlier that day. So I was able to literally walk her through the hospital process and sit there with her while she was medically cleared, and then walk her over to literally across the street to the recovery center to make sure that she got there and she was set up. I did hear from her partner a few weeks later that she had successfully completed detox and was in the residential program, which is a huge success for someone who's struggling with addiction. So really happy with that. And then just another example of another collaboration between multiple agencies is I received a call for an individual who had barricaded himself in a van in between Sultan and Monroe. There was some notes of a bomb being there, and this person had an extensive history with the law enforcement communities in this area with different behavioral health type calls. So I was able to reach him on the phone and kind of have a communication with him about what the situation was, whether he was able to come out of the van, different safety concerns that he had, while there were a number of deputies and a drone from the Monroe Police Department who were kind of handling the physical safety side of things. So he ended up walking out of the van, coming up to law enforcement, and was able to be taken safely to further treatment for some of the mental health concerns that he had that led him to barricade himself in the van that day. So those are just a couple examples of some of the work that I do in the acute crisis moments in the community that have been really powerful and fun and collaborative, and really able to help these people not only in their immediate situation, but connect them to whatever that next step resource is, many of which are in this room this evening, to make sure that they're not calling 911, they're not, showing back up and having another crisis. My goal is if I can do a one and done, that's great. It means that they're connected with wherever they need to go next, and they're on that step towards stability. So yes, thank you for your time and attention, and I will pass the mic down the line.
Council members, hello. My name is Jacob Grillo. I thought I would take a time to share now. I'm a physician assistant with Conquer, and we're a licensed behavioral health agency born right here in Monroe. We opened up in 2021, and we really aim to be a comprehensive co-occurring outpatient option for people struggling with both mental illness and or substance use disorder. I would say we're a psychiatric practice with a subspecialty of addiction medicine. So I'm one of the prescribers, and it's really my passion to see people who have one of those co-occurring disorders get the treatment that they need and deserve. We see at least 50% of people with a substance use disorder who really need to be treated for another psychiatric illness. And so there's a big lack of that kind of care everywhere, to include Monroe. In addition to the psychiatric prescribing portion, we do therapy, substance use disorder assessments and treatment, and as well as peer support services. So that's what we do. Lots of fun success stories, anywhere from the acute detox, somebody shows up to my clinic high here in Monroe, all the way to the person with commercial insurance who's functional but is not getting adequate treatment for their anxiety or depression through their primary cares. So we do that full spectrum between those 2 points.
Hello. We are Sarah from Take the Next Step, and we are working to meet the needs of families with financial barriers that need access to mental health care. So either working with the families that are accessing our resources, our resource center, or our Kids Club after school program, or our Growing Together program for teen parents, community dinners, or outreach with Mike for unhoused neighbors. We are making referrals to 3 different providers that we have. And then we are also working with the school district really closely. So we take all of the school district's referrals for mental health for families who can't afford it. And we pay for it with some of the funding that we've asked for the city, from the city for, and the county as well. And so we work with 3 different providers in the community who have a really great set of staff and interns that have been really intentionally chosen to kind of fill different niches in the community. And so if we say, hear from a student support advocate that such and such child needs support with this type of issue, then we're going to reach out to one of our providers, or pardon me, our 3 providers, and say, this is what we've got going, you know, who has availability and would be the best fit. And once we determine that, we send them on their way and we pay for 10 sessions. And then we work with the provider to, if they were to need more sessions, we could then do 10 more sessions. And we also are able to collaborate with those providers to help families meet basic needs. We've collaborated with the providers to help families obtain protection orders that weren't safe in moments. We also end up working with families that say maybe are accessing, I think of a teen survivor of sexual assault who was already accessing a program like Dawson's Place that is providing counseling for children that have been through things like this, but then she's starting to self-harm and she's having panic attacks at school. And so we're able to get her in to see one of our providers on top of what she's accessing. And that young lady is just accepted into college, and doing really well. And so we're kind of, the gaps for after those emergent needs are kind of taken care of to keep those people healthy and well, and to get them access to providers that can do so. Speak to numbers at all?
I think to date, with just the city funding that we've had 134 referrals. A large majority of that has come through the school district and through the partnership and MOU that we were able to build with the student support advocates and counselors embedded in the schools. So they're the first lines of where these kids are coming to them with some of these problems. So that's been pretty incredible. And I think even today, just to speak a little bit more to what Sarah was just saying, is that full circle partnership with these mental health providers. They just called us today to say a family who wasn't connected needs severe legal help immediately. Could you get them connected to your in-house pro bono attorney? And so we're able to connect that family into that service. And so just a great sharing of those things. And even Jessie coming to community dinner, if we've got somebody who's just experiencing like a really hard day and needing somebody to chat with, she's come down. And of course, so many of you in the room that we've worked with and really enjoy collaborating on for some of these families and individuals with just complex, traumatic experiences that we can rally around them. So,
and I think sometimes we're often dealing with kind of the aftermath of the emergent situations. So when we see families that working with a family who lost a child to house fire at the end of last year, and so that family is seeking counseling, and so it's just kind of helping our neighbors and community members to be well and to be able to be self-sufficient and functioning members of our community.
Anything further? Okay. Council, any questions or comments for this group? Okay. Thank you very much.
All right, so this next slide shares a little bit of the picture and the story between where some of these programs are funded. Our City of Monroe general funds covers about $640,000 of the funding for some of our human services programs, which includes the law embedded social worker, public defense social worker, senior center van, salaries, our council directed funding through Take the Next Step, and our human services awards. The programs that you see on the right side of the screen there that total up to 1.5, just over 1.5 million are all grants. So they come from county, state, and federal level funds that are being administered through myself and now Caitlin helping me track and manage those funds and report out on them. Some of them are direct pass-through funding, some of them are limited use funding, and some of them are salary savings funding from grants that have reimbursed programs like through our Association of Washington Cities grants that has reimbursed my human services coordinator salary a couple times over and been able to then spread funds into other programs like our peer support outreach specialist, our case management specialist, and bringing on an intern to help me with my work. So with that, we know that grant funding is time limited and not necessarily a sustainable source of funding. So we are, of course, going after more grants, but I wanted to see you all to see the impact of these grants and how they are supporting this continuum of care in our community. Deborah, do you have anything to add to this slide? I don't. You don't? Okay.
Rachel, I do have a question.
Yes.
The $1.5 million that's there, how did we get those funds? Who applied for all that money?
I applied for them.
Okay.
Yes.
So for the $650,000 investment on the general fund side, part of that is your position.
Yes.
Certainly not the full $650,000 that's on the left side. Where are you again?
I am.
We're talking
right in
about
the
you
middle.
as an asset. I'm sorry.
Oh, sorry. I am right in the middle.
Yeah, so for an investment
A
of
little over 100,000 there.
about 116,000 or so, you've generated $1.5 million in funds to
Yes.
help support some of the,
That's a
much
really
of what
great
has
way to
been in
look at
here.
it. Thank you.
Yeah. Thank you.
Thank you.
So I think that's one of the things that once upon a time, there was a lot of conversation about getting grants administrators and things like that. That was every once in a while you hear that come up, people, we need a grants administrator. Here at the city of Monroe, we have our directors and other staff members take their fair share in applying for grants and things like that. And I would just point out, again, I had to ask the question of Deborah because I'm like, wow, that's a lot of money. I said, did she apply for all those grants? ? She looked at me, said, yep. So I felt safe asking the question. That if you're just looking at economics and you ignore that we're helping people, that's a really good return on an investment to have that investment generate $1.5 million to then in turn have that come back and help the community. The other thing too is that not all of these entities that are here tonight are receiving money only from the city of Monroe.
Correct.
They're also receiving money from public-private partnerships where people are donating money and time. They're also receiving money from the state, from the county, and from the federal government, and probably from other entities like, I'm not saying that they are, but entities like the Bill and Melinda Gates Foundation or other private entities that might be collecting money. Philanthropic, that would be, see, that's why you should do this, because I didn't think of that word. The other thing too is that a lot of these entities are organizations that are already in our community, and they're organizations that are in other communities as well. And one of the things that I realized some time ago was we were sending only our chief or deputy chief to meetings where these organizations were getting together to try to have this coordinated approach. By switching that approach and having a human services coordinator, I don't know titles, I don't know names, I'm sorry, everybody. Take the next step was really smart in hiring 2 Sarahs. That makes my
Yes.
life a lot easier with names. Thank you. But I once referred, and I didn't mean for it to come off as a negative, as a ragtag fleet of service providers. And I'm sorry, that was not intended to be a negative. What that meant was we had a lot of service providers, and what we have today and existed before, but at least now it's with the city's involvement, is a great deal of coordination. And being able to leverage the city in coming up with $1.5 million to help our community is a really good thing. There are, the other approach to doing this would be to have a full department with FTEs and everything, and that's just not the model that we use. to deliver these sorts of services to help people. Instead, we rely on nonprofits to deliver services. So one of the things that when we were talking about your annual report and about human services that we talked about as a team that was important was just making certain that while we see it day in, day out, and certainly Rachel and the rest of the staff see it day in and day out, for you to be able to see all of these interconnections, we felt was important, just so that you can meet the service providers that you've been approving contracts for, like who is St. Vincent de Paul, who's Take the Next Step, why are there two Sarahs? Why does, I bet Sarah before, she looks different today, who is she? There are more Sarahs, yeah. You know, to understand how it works with parks, you know, we talked about wanting to get reports on things and interactions in our parks, to talk about what it means for law enforcement. You heard Deputy Chief Irving, who was the person who came to me and said, how about an embedded social worker in, what, 2017? You know, to hear that that former Chief Quinzer kept telling me, which was, I was not trained as a law enforcement officer to handle these sorts of issues. And I remember the frustration from him and a couple of the command staff at the time when I started. No, you're right. You're taught to handle other things. This isn't why you go into law enforcement. This is why you have human service providers. This is why you have mental health professionals and social service professionals, is to work with people like, you know, in these sorts of situations. You know, people have talked a lot about co-responders, and, you know, looking at Kyle over there, Kyle was a co-responder. You don't train law enforcement to put out fires, but fire doesn't want to show up to a scene without PD there. They're co-responders. The same thing with mental health professionals, making certain that all of these organizations are working hand in hand and that they're coordinated, and that's what we've been able to do over this period of time, is we've been able to develop a more coordinated way to respond to the issues here in our community. And the thing about, you know, the conversation that we had before about having money come from the county to Monroe to manage funds, one of the things that dawned on me that I didn't contribute to the conversation at that point was, I have complained time and time again about how resources seem to stay along the I-5 corridor. And in this particular situation, there was an interest from the county and an application maybe from, you know, from Rachel over here, to try to get money out to East County. We're the largest city here in Southeast County in the Sky Valley, so we have the resources to be able to help manage those funds. But to be able to get the money down the Highway 2 corridor, rather than hoping that we might get help from people where the majority of the population is along the I-5 corridor, was a compelling reason for us to be able to take leadership here in the Sky Valley to help other entities. One of the things that I thought about asking, but I decided not to, was what does it mean to have these services here in Monroe? What does it mean to have this sort of support? And you know, we've already heard stories of one person who used to live here in Monroe unhoused and was able to get help and is now contributing back to the system that, you know, where there were gaps before, to help other people. I think we've got another person also that has done the same thing, and probably others out there as well. So we're making progress at all different points in that continuum of care, whether it's law enforcement that might have resulted in jail before, to, you know, law enforcement assisted diversion, to all of these other ways to help people. I understand that our jail bill has also reduced over this time period. Is that correct? Because now we're able to stop the cycle. Because I don't think a lot of people realize that when you arrest somebody, people make bail. People get released. When people get released, they go home. If they don't have a home to go to, they end up back on the street. One of the things I was dealing with as a mayor early in this decade was, yeah, I just saw the PD out there. They arrested this person. That was Friday, and they're back out there. It's Monday. It's because there's a process that people have to go through. And so being able to interrupt that and being able to say, look, we can get you help, and we've got another way for you to get to a better level of self-sufficiency is, to me, a positive. It not only does what I think is the morally right thing to do by getting somebody help that's willing, especially somebody that's willing to accept it, but it also, from a benefit cost analysis point of view, is good economics. It means that while we're helping people, which I think is morally right, we're also reducing some of the other costs that, like jail and things like that. So you've got that balance. It doesn't mean that there isn't accountability for people who are committing crimes, but also, as you've heard, most of the people that who are unhoused are not necessarily people who are committing crimes either. So, you know, I ask that as we're having conversations in the space that we don't just think about that one or two or X number of people that we see, that we hear about them trespassing, stealing things, and so on. You've got a lot of families out there, a lot of people that are doing the best that they can, and their kids are still going to school, and they might be working still in some situations, but they just can't afford a place to live. So, council members, I thank you for your investment in this work. I thank the ragtag fleet. And the thing is this, that ragtag fleet is strong. You work independently, but you work together too. And even a tapestry is beautiful, it's strong. At the end of the day, a tapestry is just a bunch of threads that are woven together. And you all form that fabric of our community, that continuum of care, that continuum of housing that helps make us successful, helps make a positive difference in people's lives. From my heart to yours, I thank you all.
I do just want to add one point of clarification, and not to diminish my value at all, but I sure didn't apply for the American Rescue Plan or the SHB 1406 funding. And I do want to just say a big thank you to our finance department, Becky and Greg, who helped me in managing and overseeing these funds.
Councilmember Hanford and then Councilmember Scarborough.
Thank you, Mayor. Wow, this is an incredible night. When I read this report earlier in the week, I was really excited because this is like nonprofits and helping people is my passion. So I've been taking some notes, so no questions, just some comments. First of all, I was thrilled that you have an assistant now. I knew Caitlin as a young person who went to school along with some of my kids way before she was a Harrigan. So, so it was great to see her face there and her name on the report. And I've appreciated your husband, James Harrigan's input on the Community Advisory Committee, as well as his service on CHSAB. So it's just great to see, your face. Councilmember Beaumont mentioned recovery cafes, and I served on the Employees Community Fund of Boeing 4 years, several years ago, and got to witness several recovery cafes. And they are amazing if you have the right group heading it up. And so I would absolutely love to see something like that in Monroe, if that works out. I've seen several across the Puget Sound, so keep our fingers crossed there. Deputy Chief Ryan and Eric Britt and Roger all mentioned collaboration, and it was mentioned up here as well. While I was serving on that board, we visited multitudes of nonprofits around the Puget Sound. And the one thing that stood out was that Snohomish County, it cooperates. The nonprofits in Snohomish County work together. And it was shocking to see like the difference between King County, Pierce County, and Snohomish County. It's like night and day. The other counties, they're not talking, at least when I was on the board a few years ago. And Snohomish County was just in sync, and they had their regular meetings where they worked well together and they talked. And as you heard from, things tonight, taking calls at all hours, it's very encouraging to hear that and see that continue. I want to say a huge heartfelt thank you to everyone here. and the different agencies. You are all making, city staff, nonprofits, you are all making our community safer and caring. And that's part of our Imagine Monroe saying, where everyone is cared for and loved. Councilmember Gamble and I were on council when we implemented the embedded social worker Delgado. It was talked about recently, and loved hearing your story. Patty, right? April, sorry. Loved hearing your story, April. Yeah. Yes. Mr. Data here. I'm just so thankful for Miss Adams and her tremendous impact on our community. And so from the bottom of my heart, please continue doing the great work that you're doing now with your assistant. And to the nonprofits and the agencies and city staff here, please continue collaborating and cooperating for our community because you're making a difference. Thank you.
Thank you. Councilmember Scarborough?
Not to belabor the thank yous, but hi, Rachel.
Hi.
I wanted to wait till the end to get all, just say thank you to everybody that came up and spoke this evening and your stories. The disappointing part is that the whole of Monroe can't be here to hear it, because there's so many people out there when they drive around the city and they see a young person, or maybe not so young a person, standing on the corner with a help me sign, and you always want to give them something, but you want them to get help. So sometimes, there's an old saying, it could be Jesus. So if you don't give any money to help them, are you doing wrong? I don't know. I know that you want to help the people. So I guess I should I stop and ask them if they've contacted you?
Yeah, you can definitely, I can give you some cards. Yeah,
Say,
absolutely. Please.
Try this, maybe it'll help you, and you
Please.
won't have to sit out here in the hard dirt with a sign
100%, please.
that says help. Great stuff, that's all I can say, and it's, sometimes it's hard, especially if you're my age, and you're kind of old school maybe, and you've been in the military and you're kind of hard-nosed. So you kind of have to you have to stop and think, say, wonder if that, there go I, but for the grace of God, haven't lost my job, have retirements, so when the economy goes up 30% to go to McDonald's, you can't go there anymore, you just pony up and have like fish or something. But you look at the $20 bill and you go, how do people do that? And that's a silly example for somebody that's just looking for a bite to eat or something to drink, but you can't help but look at the people and think, there go I, but for the grace of God. So thank you for what you do.
Thank you. Councilmember Walker?
Just wanted to give a specific thank you so much, Rachel, because as someone who wasn't here at the onset of all this, to look at this labyrinth of support and actually I'm going to recommend quilt instead of patchwork. And I think of that because, if you catch someone out of a window, if there's a fire or something, if you don't have a safety net, I've seen a quilt be used before in some movies. So Monroe's support quilt, maybe. But to see that this is built out so well is just, it's tough to even imagine how you did that much work in such a short period of time. And gosh, we're lucky. So thank you, Rachel. And so grateful to have you on as well. I think you're accountable for going to be accountable for about $750,000 in grants after this. So halftime. Yeah, but thank you.
Any other questions or comments from council? Go ahead, Councilmember Fisher.
So I was gonna wait till council reports to do all this stuff, but hopefully if I say something, then you guys can maybe get home a little bit earlier. So yeah, super proud of our city, and how we handle this. It takes a lot of people, as you guys know. I referred to from the job that I retired from, which I am no longer doing. It's incredibly frustrating to go to patients where you can't do anything for them because there's no resources that are set up. So I love that this is set up here. And I've said it before, I didn't work for any cities in this area or even in this county. And light years above a lot of other cities that are 10 times our size in accomplishing the things that we've accomplished. It's been a bit of a journey for me. I think Scarborough had mentioned a little bit of old school. And I'm looking at Sarah and I'm looking at Chief Irving as my journey through helping people and being a little bit old school, probably being a bit callous from work, all of those things. So it's been a personal journey for me, and you guys have helped me through all of that. I think Chief Irving was at my house 10 years ago, just before we had a social worker, an embedded social worker, I believe, talking about some of the things that we had going on in our neighborhood and in our city. At that time, I wasn't a planning commissioner, I wasn't a council member, I was just a resident of Monroe that wanted to see some change and see how this would go. I met with Sarah years and years ago, it's probably been a decade at least, over Take the Next Step and kind of going through all of the stuff that they do. And it's been really cool to see how you guys have transformed into what's going on now. So just really, just a huge thank you to all of you, from everything from the legal side with Judge Ness to law enforcement to nonprofits. I mean, it is such a big job. Just make sure that your minds also stay healthy. You see a lot of things, you're exposed to a lot of things that are not healthy. Our brains are only capable of dealing with so much. We always used to call it as filling the cup and then it overflows. Just want to, be right at the top, but just don't ever overflow. So make sure that you're taking care of your minds as well. I think that's about all I have. So just a huge thank you. I know all the work that you put in. I know it's a lot, and I thank you for caring for our community as much as I and us care for our community. So I really do appreciate it. Thank you.
Thank you. And we still have another slide. I'm sorry.
I'll say it again. I'll say all this again after the slide.
Go ahead, Councilmember.
Bat and cleanup tonight. I do feel like I am spoiled because I get to see so many of you on a regular basis, if not daily. Especially the Sarahs and Jessica and April and Jacob. Well, especially all of you. I have been honored to have my own store be the meeting place for so many of not only your coordination, but when you come and you meet people, and even with Elisa and the different officers, and it is just so cool to watch the action, watch what's happening. I mean, even the amount of throw up that happened in my lawn because someone's waiting for Eric to come pick them up. That kind of thing. It's incredible how many times it fails, and yet you guys do it again and again. And so thank you for all of your work. I am very happy that the city can be a part of it. We are not service providers, you guys are. And so if we can help you, we want to help you. But you guys are the hands and feet. You guys are the ones doing the work. You do an awesome job. Thank you. This was a very encouraging evening.
Thank you. Let's go ahead and go on to the next slide.
And I'd love to invite Kirk Pearson up to kind of give a closing and vision to our evening together. And thank you.
Thank you very much, Rachel, Mayor, Council, and everybody here. And I think that was you, Councilmember Walker, that said Benevolent Army. Is that correct? I kind of like that. So I work for Volunteers of America, and we're part of Benevolent Army. We're partners with all these folks and great nonprofits here in the Valley. And I just wanted to give a different tact because in a previous life, I I was served 17 years in the state legislature. And in that time, when I was in the state senate, I was vice chairman of the Human Services Committee. And I think I did that for about 4 years. And one thing I did learn is, I remember back then that government can't do everything, and no matter what, but government can partner and help provide certain resources and work hand in hand. And I learned that, and maybe 20 years ago was maybe naive. I said, oh, we won't have the problem Seattle or Tacoma has, or that's an Everett problem. We won't see that out in Monroe. But no, it was always there. It really was. And but people are more educated now. They know how to help now. And it's just, with your partnership with all of us, it's working wonders. I'm learning, listening to the other great nonprofits and how the relationship that they already have with the city, and it's really humbling. So I get around a lot too, and matter of fact, I met with the mayor of another larger city today up in Skagit County, and we're talking about the same thing, how they were going to handle certain issues, and it's encouraging that government gets it. You just can't lock people up, and you can't. And I remember as a child, I lived here 65 years, and you'd have the rail cars come in, and you had box cars, and you'd have the people at billy clubs. Don't get off that box car. That's not help, but that's kind of the way it was in the 1960s and stuff. And so how far we've gone to this point, and we're helping one another, and we're finding solutions. We're building off of each other's solutions. So I wanted my hats off to all of you for doing that. I wish I thought of it myself when I was in Olympia, but you figured it out. So thank you very much.
Thank you. Any other questions or comments from the council? All right, thank you very much, everybody. And thank you very much. Did you have anything else you wanted to say?
Nope, just that's our contact information up there, Rachel and Caitlin, and we're happy to answer any questions or be a resource. And I have business cards in my office, and I'm happy to share with all of you as things that you can give out to the community.
So at the meeting next week, we'll make certain we've got extra cards, maybe a few for each council member, so that if you do see somebody, that you've got a phone number on there that you can direct them to.
Perfect. All right, thank you.
Cool. Thank you very much. All right. Next item on the agenda this evening then is council member reports. So I'll just go down the line tonight. Councilmember Hanford. Thank you. Councilmember Fisher.
Oh, yeah, I got stuff. So I went to Snohomish County. Good night, everybody. Thank you. Things works really good. Kind of felt like. Anyway, went to Snohomish County tomorrow, committee meeting. There was some stuff. One of the things, Lisa Lefebvre talked. She's the CEO of the Port of Everett. I know. And just kind of talked about how they're moving forward to have their boundaries be the entire county, with the exception of Edmonds. And so I think some of you, I know I got a pamphlet in the mail talking about it, and she basically just went through all of that. I think that they have something scheduled in May to come out to Monroe and talk with us about it. I think it's the senior center. It was
senior center. Okay.
I didn't know if there was a way to change it from the senior center to maybe this building might be a little more conducive. I didn't know if that was something that we would be able to do or not. Look at my notes here. There was other stuff. I went to therapeutic court and watched Judge Ness do her thing with her staff up there, and it's awesome. So I went in there to pick up mail, and I knew it was a court date, so I sat in on it. We just seem to walk a really nice balance of being tough, but also having resources. which is something that we've, been striving to do for years. And so I was just able to sit there and witness someone, Judge Ness, talking softly to somebody to get them to go a certain direction, but also absolutely she will bring the hammer down if it needs to come down. So we've just found that nice area of being able to hold people accountable, but also offer a ton of resources. That's kind of what tonight was all about. So that was perfect timing. Talked about, if this is the SCT, back to Snohomish County tomorrow, efforts to convert buses to electric, and also grants for new vessels for the ferry system. Doesn't really affect us, but it does kind of affect our county. Economic Alliance talked about Snohomish County tourism. There's grants available through county to promote tourism in our communities. There's some contacts of people to get a hold of for all of that. And then they talked a little bit about using non-human labor to build things. And we kind of talked about that a little bit. So good thing is it can give humans a higher skilled, higher paying job, but it also takes away some of the jobs of just human beings, which is kind of weird. I think that's about all I got.
Thank you very much, Councilmember Fisher. Councilmember Walker.
Same with SCT. Lisa.
Left something on the phone for you.
No,
Sorry.
there was something I asked for clarification about how the commissioner setup would be if this were to pass. Currently, there's 3. So I asked it if we'd be looking at an at-large or a district situation in the future. And the response I got was kind of interesting. Basically, it sounds like if this passes, it's going to be at least another election cycle or until next year, until there can be a vote to expand it from 3. And at that time, it'll be hashed out if it's going to be 3 at large or 3 districts, 2 at large. It was, I don't know, I couldn't take good notes on it, so I'm going to be looking forward to further clarification around it. But I was surprised that it would take that long to have there be some kind of commissioner shuffle if there was going to be one. So anyways, besides that, I was out of town on Saturday, but my wife and son went to the Easter egg hunt at the turf fields, and they said it was amazing. Or he's not talking yet, but she said it was amazing. So thank you, Mike, for as always putting on such great events for our community. And other than that, I'm just so I just beat a dead horse, but I'm grateful for you guys as well to be able to be on this journey with you all, and the empathy that you practice. I think it's special. So thank you, and thank you to the city staff as well.
Thank you. Councilmember Beaumont.
Jake, you're just so eloquent. Oh my goodness. Love following you. So a couple things from me. First of all, I am really thrilled. There's traffic calming going on 154th, which is in my neighborhood. And I think it was Officer, I hope I got his title right, Carswell? No, is he still? Yes? Yes, Sergeant. Sorry, darn it, I knew I was going to mess it up. Anyway, I actually live in the Frylands, and I observed him drive up in the city truck and install the traffic calming device right there on 154th. And it was really wonderful to see. It's already made a difference. I've gone out and watched, and I'm thrilled. And everybody in that neighborhood, that was one of our identified speeding areas when we got briefed on, the different arterials that are really an issue, and that's one of them. And it's made a huge difference, and that allows me to point to that and say, hey, the city is listening. Kevin, I know we're neighbors. A lot of us live in the Frylands here, and it was just wonderful. And it was just great to see him out there. And I almost wanted to go say hi, but I was on my way somewhere else. But that was a really positive thing. Also, just wanted to get back, kind of circle back to this discussion we were having about all the people that were here in this room tonight in this presentation. And I really, really appreciated what Councilmember Scarborough was saying about somehow, whether it's age, I'm also older, and understanding the plight of some of these people that we're serving is not always easy. And this is a plug, sort of a segue from that conversation, which I really appreciated your comments. All of us have our own bias and our own experiences and feelings that we bring maybe to some of these situations. And we all like to think we're really open-minded and empathetic and caring, but we all bring our own sort of experiences to how we deal with this and how we feel about it. So there is another inclusivity training going on this month here in Monroe. It's led by, I believe, Melanie Ryan, Monroe Equity Community. I attended the training and it was very, very good. And it just encourages you to sort of consider other people's experiences in the world and what they may have been through. And this is definitely a perfect segue to encouraging council members and city staff. A lot of people have already attended it, but if you haven't, I believe it's April 20th. It is a weekend and it's a big ask, but it was very, very well done. And I think it will help us all if you're able to go. Just continue to be the open-minded, empathetic people that we all want to be as council members and community members. So last but not least, we had a great turnout for the Monroe Historical Society presentation. And we had Councilmember Fulcher in attendance, and we had Director Bailey, and we had Director Farrell. So I really appreciate the city support. Thank you so much. It was a really great presentation. We always love doing those. So that's it. Thank you.
Thank you. Councilmember Fulcher.
Well, you know where I was on Saturday afternoon, but on Saturday morning, I was also at the Easter egg hunt, and it was a lot of fun. I expected a little more chaos, and so well done, Director Farrell. You did a very good job, and so did all the volunteers who were just really good at monitoring all the spaces and making sure it went off without a hitch. So that was very good. And then on Saturday, 11 o'clock, I was at the ribbon cutting for the Orange Line for community transit and the rapid transit, the Linwood Station. And it was quite the big to-do with all the, fancy and whatnot. I did mention to the CEO at that point, I said, hey, nice orange tie. And he said, hey, nice orange hair. So apparently I was festively dressed. But anyway, thank you also for that Monroe Historical Society presentation. That was really wonderful. It was entertaining to be a part of that. And finally, I got to join the institution that my great-grandparents helped to start in 1976. So there we go. That's it.
Thank you. Councilmember Scarborough.
Well, I'll try and be short. I went to the Easter egg hunt a little late, but Dory and I enjoyed watching the kids picking up what was left, and saw Mike and Ben Swanson, and they did a fantastic job. Thank you for what you do. And those are the kinds of things that keep people coming back to Monroe. Thanks.
Thank you. Councilmember Gamble.
No report.
Thank you, Councilmember Davis. Gamble. All right. Let's go ahead and go to the city administrator extended report. Extended agenda.
Extended agenda,
Yeah,
yes,
not
not
the
an
extended
extended
report.
report. Even the
It must be
extended agenda
bedtime.
is going
I'm
to
sorry.
be, is going to be shortened. But I need the next slide. Thank you. And I'm running fast, running out of power on my laptop
I am
too.
too. I'm going to shut mine down.
I'm going to make this quick. So we do have a City Council Legislative Affairs Committee planned for April 9th. That's next Tuesday. We have a couple of items, a resolution extending the Community Human Services Advisory Board, and then looks like potential council amendments to the rules of procedure. And then the discussion item will be the 2024 legislative recap, and then grant applications. Going on to the regular council business meeting at the same night, the only thing I want to say for this one is a contract with the Colacurcio brothers, which I butchered last week, but practiced and got right this week. Yes, thank you so much. Authorizing the mayor to sign the local agency consultant agreement with Excel Tech Consulting for the 179th Avenue Sidewalk Construction Project, Boarding Commission work plans, and the interlocal agreement with Snohomish County for Affordable Housing and Behavioral Health Fund. And then department reports ending that meeting on the 9th. So those are the two upcoming meetings that we have. can skip on to the
Go
next
ahead,
slide after
Councilmember
that.
Beaumont.
There we go.
Going north to Alaska. Copy that.
All right, so under the city administrative
Moving on.
reports, we have just an announcement that the Association of Washington Cities does currently have openings on their legislative agenda committee and their policy committee. So if anybody's interested in being a part of that, if you could contact me or Zach Humphreys, we can get you connected and apply for those open position. Under save the dates, these are items were mentioned at the last meeting, but this Thursday we do have the Trails Master Plan open house from 6 to 8 p.m. at Park Place Middle School. On April 9th, the mayor's State of the City address. So thanks to all of you who contacted me or Zach Humphreys about signing up for that. April 30th, just mark your calendars. That is the 5th Tuesday, but we're going to have the City Council Strategic Plan and Budget workshop. And then it's Thursday, May 16th will be the port boundary expansion open house from 4:30 to 6:30 at the Monroe Senior Center. So if you were wondering when that was, because Councilmember Fisher had mentioned it earlier during reports. And that's it for me. Thank you.
All right, any questions for Deborah? Go ahead, Councilmember Scarborough.
May 7th.
Thank you. All right, for me, just report egg hunt. So went to the egg hunt. A whole lot of people there. Staff did a great job. Volunteers did a great job getting stuff out there. Mike, how did everything go with the egg hunt? Did everything go okay? Okay. I thought I'd ask in this format just to double check. Thank you. All right. So egg hunt went really well. Just because it's come up by a couple of the council members, the port item, I was interviewed twice. I think I shared my concerns with the council previously. I am not opposed to becoming part of the port district. My only concern is what Councilmember Walker brought up, which is an issue of representation. I am concerned if they do have 2 at-large positions and 3 districted, that there is the possibility that we could get outvoted on things. And so, again, our population is just a little bit smaller here. That's one of the reasons why our national government is set up with a House of Representatives and a Senate. And so those smaller states have an equal voice in one of the 2 chambers. And so I am concerned that if they don't figure out the governance before they go to a vote, that there will be a lower likelihood that we'll be able to leverage resources out here from the tax dollars that our residents will be paying into the system. And so that is my primary concern. It shouldn't take the folks at the Port District by surprise. I am thankful for the work that the Port District has done to support things, even though we're not in their Port District today, like 522 and Highway 2. But when it comes to money coming out here from the money that we put in, if we don't have a representative that we can hold accountable, somebody that we vote in, kind of like our county council member, I am concerned that we will not have as much leverage in getting resources out here as the greater population along the I-5 corridor. So it's raised in Virginia, kind of, have this thing about wanting to be able to manage my own stuff in my own community. So just my thoughts there. As you're talking to them, that would be the one thing that I would ask you to inquire about. How is the governance going to occur? How are you going to make certain that we're going to get resources here? Those would be my concerns. Also, I'm not going to, so this will be something that will be going to a ballot. I would encourage you to go to the senior center to learn more about it and everything like that. So anyway, just some thoughts there. I'll be happy to talk offline if anybody has any follow-up questions. But that was my primary concern, was governance and representation for smaller communities like Monroe. Okay. I don't think I have anything else. I think egg hunt was where I should have left things, because egg hunt equals fun. And we had a lot of people out there. I don't have anything else this evening. Does anybody have any questions for me? All right. I will add this. So we did hear a presentation today from a bunch of different folks. I hope that you take a moment and just reflect on the fact that each and every one of you and the people that sat in those seats before you, some of them, made all that possible. Okay, just the coordination. And Councilmember Fulcher was right. I mean, they're the service providers, but recognize this also, that the coordination didn't exist before. That coordination has done a lot to leverage more resources, and I think has helped enhance what the service providers have been able to provide. And that stuff goes back to you. Okay, so one of the things, I don't know if I shared with everybody in the last go around when there was that vote on whether or not to do the funding for that emergency housing that ends at the end of June. That week, we had somebody who called on a Friday looking for housing. But for the fact that you approved that on that Tuesday, that family, two adults and a kid, may not have had housing that night. They actually used the resources that week that you all voted on that. So please, you did hear from people today. I'd like you to go home, look in the mirror, and just reflect on the fact that you each had a hand in making that happen. Okay? So from my heart to yours, thank you. We're adjourned.